Yep.
The next thing to show is actually making an outpatient note in the chart. So back to this view here, this is Pat who has come to see me. I can see the status here of his visit. At the present he's only scheduled. Once he's clocked in, or once he's marked in as by the ward clerk, it'll show up as room assignment in progress or waiting, depending on how they have shown that. I am going to open their chart and I'm going to start the visit. The system warns me that he's not arrived yet, but I can go to enact and accept, and then I can go to start the visit, and that will mark him as attending. You'll see that the tabs
enact and accept.
Yeah.
Get him into your room.
That shows that they're going to take responsibility for marking their notes, and then that start the visit marks them as attending. So again, it shows all the different tabs across here. Chart review, I can go and see everything here. Growth chart is very helpful for seeing the growth chart of the baby, but this isn't the baby, so it's not showing anything. The important ones to show are intake. They are the ones that the nurses weighing the child and measuring them in the first place will go to, and they'll go to vital signs, enter new reading, and enter their weight and height there. If you want to add a head circumference, if the nurse hasn't done that, the best way to do it is to go to intake and go to vital signs, and either go to new reading and enter their head circumference there, or add it to their measurements that they have already made. And that will
is it in this list?
Chart. Head circumference, he's probably too old
test
for
case.
it. Yeah. For a baby that will show up, so I think he's outside the normal age range for that. But I can also add historic weights and heights by going to new reading, changing the time taken to a historic date. So 1st of January 2024, and then add their previous weight, for example, there. So this is an adult, say about 70 kilograms. And that will mark their weight as 70 kilograms on the 1st of January 24.
You can probably close that.
Close when you're happy with that.
Yeah.
Some of these other things are doubled up between intake and charting. So charting is where you'll do the main bit. You can enter their reason for attendance, for example, headache or review or whatever you want. Visit diagnosis, so that's their final diagnosis. You can enter it there, or you can also enter it at the very end as add diagnosis there.
It's at the bottom, was it?
Yeah.
I would have thought you'd do
that at the very end.
Yes.
Makes most sense. Problem list is for their current problems, so you can check and update that if necessary, and then as appropriate go down to the bottom there and click mark as reviewed if you're happy with that.
Okay.
Allergies and contraindications you can add there, mark as reviewed. You have to do this to be able to prescribe new medications, or you'll get an error message at the end. And then medication management, you can check these are all correct, delete ones that the patient's no longer on, or add new ones by going to patient reported and enter that.
No, we still haven't written any notes.
No, that's it. Hit the mark as reviewed. That's the bottom of that section. To get to the note, you click. I have to reopen the sidebar as I closed it earlier, and then I type my note here. By far the fastest way of doing this is using a smart text. You can set up notes on these buttons here. I have my own ones here, and you're very welcome to copy mine. So I have, for example, one here for child new. If I click that, the note will populate here. It automatically draws in these bluey bits here from the rest of the chart, and then these pinky red bits are ones that I have to enter. So mine's set up for a child's clinic, as you can imagine. So basically you can enter all the bits as necessary, enter your notes here. You can use smart text to help you. You can type it in. You can use the examination.exam smart link to help, and that will bring up this button here, examination, which will open NoteWriter, and then you can enter all the details there, and that will automatically transfer over to the other side as well. I'll just click a few random ones there, and you can see it'll turn into prose down there. Finish your note in whatever way you want. I have an impression and plan, set it there, and I'll just delete those out just for the sake of speeding this up. Hit accept, and that is your note completed. To finish the visit, go to conclusion. Set the visit outcome. This is a first treatment today and I'm discharging the patient, for example. If I wanted to review them, I can use the speed buttons to order follow-up, in which case speed buttons. So if I wanted to order a follow-up in 6 months, I can click order, hit accept, and that will automatically add an order here. And then I just need to type in the basic details, and that will set up, that's the fastest way to set up a 6-month review. Hit accept, hit sign order, and that will enable that. Patient instructions. If you want to add instructions to the after visit summary, you can do that by clicking there and typing in whatever you want. I can print an after visit summary if I want to hand any immediate information to the patient, but I have to add my diagnosis before then. Ideally, any orders I place will be placed in that. Correspondence is where you send a letter to your GP, to the patient's GP. There are different templates there. I recommend you get your My Clinician letter set up to how you like it. If I click there, it will give me a template here for this patient, and that's ready to go. Up here it shows where the letter is being sent to, so I'm going to send it to people. The GP practice isn't set up. Our GP practice will be normally the best one, and then copy to the patient if that's your normal practice. Once I've done that, I can route it now, which will send to my secretary. I've got route draft to staff, my secretary's name in there. If I hit route now, that will send this to her as a draft. She can check it and then post it to the GP and patient. I'm just going to cancel this for the sake of, so I don't want to send my secretary an actual letter. Once I've done that, the final thing to do is to click sign visit, and that will finish everything off.
Thank you, Carl. And we'll do a few smaller piecemeal bits in another video or two, and I'll also show you how to do medications. Thanks.